Good evening. Welcome to this evening's webinar. My name's Nick Atkins, and I'm joined by Nicola Alexander Cross for this evening's webinar. Before I get going, I just want to share a slide with you. As I say, tonight's webinar is From Drops to Devices, Exploring Modern Dry Eye Treatments. Some of you will have possibly joined our previous three webinars. Tonight, as I say, is the fourth and final webinar of the series. They ended up a little bit out of order, if you like, from a natural flow, just due to the availability of our speakers. So we will talk about drops, which perhaps might have been a conversation for earlier on in the webinar series. But if you have missed any of the other webinars, I would encourage you to go and seek the recordings out. You can find the links to the recordings on the Dry Eye Zone website under our Dry Eye January page. If you have any questions this evening, also feel free to put questions in at any point in time, and I will deal with them all and pick out the best ones and the most appropriate ones to deal with. As with everything in here, the advice is generic. We can't really offer you any specific advice as to your eye care, as we are not privy to all your details, and of course we wouldn't want to undermine your practitioner who may be advising you. One thing, those of you who've been on before may well have already done this. If you haven't, we are offering an Ultimate Dry Eye Reset Pack, which includes a heated eye wand. We'll talk a bit more about that as we have the inventor of said device on this evening. There'll be some preservative-free lubricating drops, some lid cleansers and wipes, soothing eye gel, and some gentle dry friendly makeup. All you have to do is scan the QR code and follow us on Instagram. Comment on our last post, the worst thing about having dry eye, and tag a friend who needs to see this. So if you do that, then you've got a chance of winning our dry eye reset pack. So it leaves me to welcome Nicola. Hello, Nicola.
Hi, Nick.
Nicola's joining us from the US during the day.
Neil.
So let's just set the scene. I mean, your company and others have been kind of involved in the growth of products for dry eye. Why are we seeing so much more product development in the dry eye space, do you think?
So I think, first of all, there's just a lot more people who are aware of the symptoms of dry eye. So, even when I was at university, which wasn't that long ago, it was just kind of one tiny topic that you were told about of many, many, many things that of a reason people could come into your practice. And now we're seeing that actually it's the second most common reason people go to the optometrist is because of the dry eye symptoms. Obviously, the first most common reason is because they need to see clearly. So the symptoms, I think people are much more aware of their general health and they're paying attention to their symptoms post-COVID. And part of that is eyes. And we've gone from knowing that 33% of people have dry eye related symptoms to now as many as some studies say that 80% of adults show that they have dry eye symptoms. So I think that. And then second to that is that we're just seeing that a lot of the products that were originally on the market are part of the problem or that we're creating part of the problem. And that's why I think there's been a lot of innovation in the companies coming into the space.
Just expand a little bit on some of those products being part of the problem.
So in, for example, the cosmetic space for women, we now know a lot more than we did. For example, thanks to the TFOS studies, which are fairly recent. And there we're learning a lot about all the ingredients in these cosmetics that we like women apply to their face daily. And then seeing that, wow, there's not that easy of a, it's not as easy to substitute these ingredients. And eye care professionals are normally the only people who know as much or care as much. So coming in from that respect, I think also a lot of the products on the market traditionally that are owned by big pharma companies, for example, are pure symptom relief. They're not designed to tackle underlying issues or like promote overall longevity. So I think because of that, there is this white space in the market to do a little bit better and disrupt like the traditional pharma aisle.
Yeah, and it's interesting. I mean, the most obvious one is eye drops.
Yeah.
in as far as that being the kind of staple for most people. And of course, there's over-the-counter eye drops. Um, well, most drops are available over the counter, not all. But if we're talking about that, then clearly there's a huge range.
Mhm.
And it's probably fair to say that a lot of the over-the-counter stuff isn't sold through optometrists or ophthalmologists.
Yeah.
And that's because they're not always that effective.
Exactly right. Honestly, the boom in eye drops is, I think, quite scary because there are all these to a customer. I think a generic eye drop, if you think of that classic eye drop bottle, looks pretty similar. You're not really scrutinizing who's made it, but there is, even in that category, there is the people who do it really, really well and have been making eye drops in a very responsible way for a long time. But then there are all these kind of cowboys that you're seeing on Amazon. If you go look on Amazon or eBay, there are a lot of eye drops that are just popping onto the market that have very questionable ingredients, not always coming from the EU, like sometimes coming from China, wherever it is. So, yeah, I do think for a customer, your optometrist, and one thing we know is that like the trend, especially with AI and like the rise of platforms like Amazon, is that customers are trending towards going to an expert for advice because there is just it's so hard now to scrutinize information and and the sources come from. So I think this is a really good opportunity for optometrists to reclaim like that category in their practice. While there is this moment where people are kind of becoming aware that not everything you buy online is probably good for you.
Yeah, I mean, I think the gold standard has become hyaluronic acid, and we were chatting just beforehand about not actually drops per se, but there is hyaluronic acid and there's hyaluronic acid, and
Exactly.
similarly within the other categories, there's omega-3 and there's omega-3, and I can't remember the one you cited to me before we started, but the just because it says it's got HA doesn't mean it's
100%.
a good quality HA. And now I think we're seeing other ingredients added to hyaluronic acid that
Yeah.
act in other ways. So there are some products out there now that have moved that game on full, may move that game forward a little bit. But yes, as you say, a lot of the over-the-counter stuff, of course, contains preservatives or chemicals in there that might not be listed as preservatives, but also actually are toxic or potential irritants to the eye. And how is someone supposed to work their way through that minefield?
Exactly. So I think in this space, there's like the active ingredients that are tackling in the case of eye drops are just pure symptom relief, right? That's all they do. You have the problem, it'll correct it for a short period of time, and then you have to apply it again. So there's the actives that do that. And we're seeing a little bit of innovation in that space. So things like, like Buckthorn is one that we use in our eye spray. That's like fairly recent in terms of the clinicals on it. But hyaluronic acid, sodium hyaluronate, they've been around for a long time. Glycerin, we know these work. But then there's the inactive ingredients that are just in that bottle to stabilize those actives. So that's your preservatives that make it shelf friendly. That means that it doesn't grow bacteria, mold, or yeast. We're learning that those stabilizing ingredients, and there's also other categories. So there's the preservatives, there's the emulsifiers. So if it's a formula that has oil and water, it has to have something that makes them kind of blend together. There's like the stabilizers. All those ingredients we're now learning are actually quite bad for you in in a lot of respects. And then the third category is then the packaging of because a lot of the cases, if you have an open container that has water in it, you have to have a preservative in it for it to be safe because air can get in, other water can get in, it can grow bacteria very easily. So that middle category of all those ingredients that are just there to stabilize that active is forcing innovation in packaging. So we're moving towards very a high like growth area of finding packaging that allows a product to stay preservative free, for example, but the packaging then has to be super safe and bacteria can't get into it. So that's where you're seeing kind of the squeezy drop bottles. You're seeing things more like sprays, which are a bit easier to keep fresh. And I think you're seeing a bit of a rise of like the single use, the minims as well.
Just on the sprays, I mean, it's interesting. There's quite a few on the market, and obviously you have one in your range. Just for those people watching, what is the spray trying to achieve, and how does it achieve it? Because there is good research to support that certain sprays do boost the tear film. Um, but at first glance, you think, well, how the hell does that work?
Yeah, no, totally. So house sprays certainly have been shown to be highly effective. Our one, for example, does have clinical trials that have been done on the sea buckthorn element of it. And how they work is, first of all, an eye drop, most of the eye drop, it drains almost immediately as it goes in your eye. So it's not actually working on the surface. With this spray, it sits on top of your lids. And I think like we like to think of our eyelids as like this airtight seal, but in reality, there are little gaps. And as you blink, that eye drop gets in, but also when you spray it in, a little bit does go in as well. So it's a kind of a slower release mechanism for the solution versus an eye drop, which, 70% of that is going to drain almost immediately as you put it in. And then a lot of
What
people, sorry,
Carry
no,
on.
when we're doing the research on the category, there are a lot of people who are actually quite afraid of putting things in their eyes. So I don't think that they're substitutes for each other. They're just a different kind of product. So some people, eye drops, they're used to putting eye drops in. Seems very intuitive. Other people, they just are never going to put anything in their eye. Or if they tried, they wouldn't get it in because they'd be too scared of it.
And the theory being that these tend to sit on the surface of the eye and mimic the lipid layer of the tear film, that oily layer at the front of the front of the tears. So, and that I guess is also their limitation. If you need something more to boost the volume or work at the ocular surface, the sort of mucin barrier layer, as it were. Okay, moving on from drops. What do you see as the other key at-home um, treatments, if you like, that people can do?
So I think cleansing is where it's just such a low-hanging fruit that all of us as optometrists can recommend cleansers now. And it's also a source of a lot of problems. So we're seeing this massive boom in styes. Like really from it used to be, like styes affected younger children, and then once in a while you might like every decade you might get a stye. Whereas now people are getting these recurring styes, and I think that all comes down to lid hygiene being, well, first of all, our eyes are very vulnerable because they're all been put through a lot, and our meibomian glands aren't working properly. But then our lid margin is very vulnerable, and we're applying things, taking them off, we're stripping it. So cleansing is really important. And I would say like everybody could benefit now from just like a daily cleanser. And then you also have at home, we have the heat aspect of it too for people who are, we know, suffering from dry eyes. That can work. And then there is the general piece around what kind of environmental factors, how can you improve you know, your room or whatever it is to help you. But for at home protocols, I think for daily practice, a cleanse, a heat, and then maybe some kind of substitute if they're using an eye cream, a better one. If they're using a cosmetic, a better one for your eyes. That would be the kind of baseline.
Okay. Um, Obviously, there's a lot of cleansers from some of them that use quite, strong active ingredients, shall we say, through to more gentle ones. What would be your top tips of the sort of ingredients someone should be looking for in a obviously they come in two formats as well, in a wipe or in a foam or a gel or whatever. What would be your recommendations?
So my recommendation right now, the one that is the most universal that everyone can use is hypochlorous acid because it does cleanse. Like you do need to apply it to a cotton swab to get the cleansing element properly, but it's just so simple. It's naturally made by your body, hypochlorous acid. It's naturally antiviral and antibacterial, and it's essentially works to support our natural immune system. So that means that you don't need to have preservatives in it. Just naturally, it ticks a ton of the boxes that you would look for in any eye care product. And everyone can use it. Like 80-year-old man can use it, a 21-year-old woman can use it. It's so universally applicable. Then outside of that, I think for women, they have like maybe a higher need because they have waterproof eye makeup or like false lashes, lash extensions, all these other kind of complications. They still could use a hyaluronic acid, but if they need something a bit more heavy duty or heavy working, my guidance is always to go oil based. And that's simply because I'd say like near impossible to have a water-based, very effective product to take off your eye makeup. that does not have preservatives in it. And oil will just do the job, but doesn't have to have preservatives in it.
Okay. Um, you mentioned hyaluronic acid. Do you mean hypochlorous acid?
Sorry, hypochlorous acid. Yes, hypochlorous is the one. So sorry if I said yeah.
That's fine. I was getting myself confused there for a minute. Actually, that was one thing we spoke about before, is that again, there's hypochlorous acid and there's hypochlorous acid. Do you want to talk us a bit through that?
Yeah.
Because you don't really want to be using any old hypochlorous on your face.
No, we've been doing a lot of research into hypochlorous acid, and it's a very, very, very reactive molecule. So it's your body produces it naturally, but you can also, artificially make it into a spray normally. But if you have anything else in that formula, except for literally hypochlorous acid, maybe mineral salts and water, that's it. The hypochlorous acid will react. So you see some of these formulas, they say, oh, has this fragrance or has chamomile or has whatever else. But that just means that essentially in the bottle is just water, because hypochlorous acid will react with almost anything around it and it will just turn into water. Likewise, the bottle it's in has to be basically a fairly thick plastic. If it's in an aluminium bottle, it will react and then it will just become water. It can be in a glass basically or a plastic bottle, and then it's hypersensitive to the atmosphere and also to light. So the bottle has to be opaque or in that kind of dark amber that you sometimes see. It's similar for supplements to protect it from light. And then that is how you make sure it's good hypochlorous acid. Also, most hypochlorous acids, they will have a fairly short shelf life, and that's on purpose because, again, it degrades over time. They have found that the sprays last a little bit longer than just an open dropper that you sometimes see. But for me, hypochlorous acid now is like the number one thing in my toolkit that is for everyone can use it. And it's so gentle because it doesn't have all these ingredients that can be a bit reactive and sensitizing. You can use it on children. Like it's an all-rounder for me that everyone should just like be using every day, essentially.
Yeah, I think it is the development of and the use of hypochlorous around the eye has been a bit of a game changer because
Yeah.
we know it lowers the level of all the microbes around the eye and improves the microbiome. So you're reducing bacteria, fungi, and it's antiviral as well, of course.
Yeah.
And with that, reducing the bacteria, of course. And I think we touched on this in one of the other webinars. Your That's what produces the toxins that causes inflammation. Dry eye is an inflammatory disease. So if you're taking down the microorganisms to a safe level, you're not eradicating them completely because we have a natural microbiome and we just want to keep
Yeah.
it healthy and not overpopulated with some of the nasty organisms that
Totally.
can cause inflammation. So I think that's going to become a game changer for a lot of people. And it's just so easy to use, isn't it?
So easy.
Just
It's so
spray it
easy.
on.
Yeah, and also because it tends to be naturally pH balanced to a tear film, it doesn't sting. So there's really no barrier to anyone trying it. It feels refreshing when you spray it on or when you use it. Yeah, exactly. It's really a universal all-rounder, and it's something that when you start using it, your patients, I think, or they'll benefit from it quickly enough that you'll start to see the happy patients coming in the results.
So let's move on to heat because it's kind of an area of interest of yours. And just talk a bit about meibomian gland dysfunction, the role of heat, and what you've been involved in really in the development of the heated eye wand.
So we know these meibomian glands that we have in our upper and lower lid, that they're just not functioning as well as they should be for most adults, and honestly, even for we're finding in children.
Yeah.
And that's for a couple of reasons. The main reason is that they are blocked at the lid margin point. And that if you leave that for a while, that can then move further up the meibomian gland and cause like further solidification higher up. But also we're seeing that they're starting to, there should be this beautiful, nice like toothpaste tube line. They're starting to, kind of become a bit tortuous, which means that they're not working optimally. So, and that always comes down to the flow. And part of that is the inflammation, as you said, because if you leave it stagnant in there for a while, then the inflammation is going to also start to become worse. So for heat, the easiest and the way that, we know for sure works is to apply heat because that liquefies the oils. And then if you can follow that application of heat with like very gentle massage in the right kind of way, right by where it matters, you can then restore some of that natural flow and get these glands working how they should. There are so many ways to apply heat to your eyelid, and I really think it's down to the person. So some people love a heated eye mask that they just sit and they just enjoy that peaceful time with their eyes closed. And now there's like more than ever a huge range. There's the single use, you snap them, you put them on, single use done. There's the USB ones. There's the traditional microwave or the oven. And then there's the devices like ours, which are for people who can't really afford to sit and, have their eyes closed for 10 or 15 minutes a day. And it's targeted and you can do it, with your eyes open to some degree. And it's quick. It tends to be quicker because it's more targeted heat. So those are the ways that we can do it. But I think the bottom line for me is, and why we've spoken about this before, Nick, but why the original genesis of the heated eye wand was purely because compliance is so low on the mask versions, because people do struggle to find that 15-minute commitment every day, and you do need to stay on top of it. Like you said, it's an inflammatory condition. You can tackle it, you can get on top of it for 2 weeks, but it probably will come back and cycle. So you really need a consistent routine. And I would just go with whatever people are going to use most regularly.
Yeah, exactly. And I think that's one of the areas. And one of the other benefits of the electronic devices, as you mentioned, USB masks as well as is that you can select the temperature and it will be for the right period of time. And yeah, we would always encourage a temperature of as high as you possibly can tolerate.
Totally.
It's better to have low heat than no heat. Um,
Exactly. And
but
heat is subjective.
yeah.
Well, this always fascinates me, but something for me that will be really cold, honestly cold, is for someone else quite hot and not tolerated well. So having a range is quite helpful. What you often find is that people then also can build up to like a higher level of comfort.
What is the temperature and for how long, just for everyone to know?
So on the actual eyelid, the ideal is about 42 degrees centigrade, and you want to be applying that at least 5 minutes per eye. For our heated eye wand, you could do it for 5 minutes per eye if you were doing it very consistently. But if you were someone who had a much more long-standing issue, it probably would have to be 10 minutes.
And if you're using a mask, you'd use it for sort of 12
10,
minutes or so, wouldn't you? 10
yeah,
to
10
15
plus,
minutes.
10 to 15 exactly, yeah.
Yeah. Perfect. So there's increasingly in office or in
Yes.
practice, you would say in office in the US, we would say in practice in the UK, treatments. How do they complement, or how does the at-home stuff complement some of these therapies? And do you want to just touch on some of those therapies?
I think that in practice treatments are it's booming in the UK, which is wonderful. And in the US, honestly, in the US, it's I would say part of most traditional practices at this point. Like it's the table stakes. And that's because they are so effective. If you have people who are coming in who've had long-standing dry, even like a contact lens patient who you've known for 15 years, you did their original contact lens fit, it is very, very hard for any at-home product to break that cycle. But an in-practice treatment, and it has to normally be a series of treatments, can really break it for them. So I think that's where the compliment is. I like to see the in-practice treatments as like setting it up right, really breaking the cycle, getting you into that good hygiene. But then you do need to maintain it at home to see long-term results. And also realistically, people might commit to like your first 3 IPL sessions, but after that, you will start to see that they struggle to come back. So it's just being reasonable about what your patient's capable of. And just saying, okay, here's a course of, 3 or 5, whatever your practice offers, but then here's your maintenance you do in between. And then next year, we might do another course of IPL to just like reset on that. But it's not like, I don't think it's that reasonable to expect a patient would come in every month, for example, for an in-practice treatment. First of all, because financially it's normally quite difficult. So they really complement each other. But the treatments we're seeing in practice are very innovative. You have I think of them in like 4 categories. So you have the heat base that are tackling that MGD, and that's heat that's applied by light in the case of like IPL, or applied by energy in the case of like radio frequency. And then you have the the light-based inflammation ones, so like the low light therapy masks and the LEDs. Then you have the physical, the like mechanical thermal expression, which are more like your LipiFlows of the world, your tear care. And then finally you have the lid margin exfoliation, which is like your BlephX, your Zest, that cleaning and like cleansing the lashes. Those are kind of the four categories. And in general, the best outcomes are when people do a multimodal. So they would do like a lash exfoliation, a cleanser, plus a LLT mask. Or they'll do like Envision is an extraordinary brand. And they combine both in one device. They have the IPL and the radio frequency together.
Just for those who don't know, IPL is intense pulse light therapy. Um, doesn't obviously, it's not a, I think the important thing for everyone to understand, even some of our own colleagues, is it's not a miracle cure and it's not a catch-all for all kinds of dry eye, and IPL won't work for everyone.
It's true. And it
Um,
also, I do think it's worth saying that it's for some people it's quite uncomfortable.
it is.
So it's not like everyone who walks in is going to love the experience of being in the a lot of the in practice treatments. I think you have the expectation set with the patient about because people are weird about touching their eyes. Like we're not because we're all optometrists, but people are, and sometimes they get a bit taken aback by the protocol of what's required.
Yeah, and I think the other interesting thing is that not everyone will respond the same way. Some people, have almost immediate after their first treatment improvement.
Yeah,
Some people it's third or fourth treatment in before they see an improvement. Some people even get worse
it's true.
before, the first treatment makes them feel worse before they start to then improve over subsequent treatments. So, there's a lot to bear in mind if you're going down that route. What would you say as we start to wrap up? And if anyone has any questions, please feel free to pop them in the question box. We haven't got any at the moment, but we had a lot come in late in some of the previous webinars. Um, Someone who's just starting to manage their dry eyes, what is the one small change they can make today that will just help them quite significantly, do you think?
So if I was an optometrist and you're just starting to see those early symptoms of, oh, my eyes are a bit red at the end of the day, my eyes are a bit watery, they never used to be, I would say first thing first, get your cleansing right. So just to protect your eyelids, start to tackle that bacteria, like you were saying, hypochlorous acid. Obviously the like slight lifestyle changes, like increase your water intake, maybe adding some supplements to your routine. But then I would say incorporating heat or something like that into your daily at home routine is a very easy way to just start taking very good care of your eyes in a way that you'll notice like your eyes will look bigger and whiter and brighter. Um, I do also think, you know, if you if you are someone who was just a bit worried about it, it is worth doing like a full assessment on the anterior health to get a baseline. So if you do have meibomian gland imaging in your practice, or even like the basic ones like tear breakup time that everyone could do, just getting a baseline just to see how it tracks over time is always helpful for a patient to understand where they're at in their dry eye.
Yeah, yeah. So, I mean, that kind of leads on to I was going to ask you about, when some of the, you've done the cleansing, you're doing the heat, and it's not quite working, then fundamentally you need to go and see
You
someone, an
have to.
optometrist or an ophthalmologist, who can do some of these diagnostics, look at the meibomian glands in more detail, look at how, whether the meibomian gland openings are plugged, look at then dealing with that in practice, getting the glands, um, uh, the meibum flowing and the glands openings cleaned out and flowing with, because ultimately, coming back to the whole eye drops and the eye sprays, what they're trying to do is, the name we often used to apply is artificial tears, isn't it?
Yeah.
And
Yeah.
actually, you don't want artificial tears, you want your real tears,
Yeah.
because
You want
they
good
are very
quality.
complex and we still don't understand them properly.
Yes.
And the clever, how clever the natural,
Yeah.
well, the human body is in general, but the tear film is so complicated and we're nowhere near replicating it with
Yeah.
artificial solutions. So
Completely
producing
right.
your own tears is always going to be the best way,
Best.
isn't it?
I couldn't agree more. And I think we get, if you saw how many hundreds of emails we get a week asking about specific condition, we can't give specialized medical advice because we're just sold online, but we always say go to an optometrist, and people are actively searching on Google for like dry eye optometrist near me. So it is like a big opportunity, I think, for practices. But the really important thing is people don't know they could have aqueous deficient dry eye. Like no amount of heat is going to help make you improve that. So it's really important to go to an optometrist who can help you understand what type of dry eye do you have, what stage are you at, and then like specifically prescribe you what would be a good protocol for you. But that being said, I do think that we all could just do better basic hygiene of our eyes, and also just like not touch them as much because a lot of people touch their eyes a lot. And yeah, when your barrier is very weak, like a lot of ours are right now, the bacteria does just get in and create more problems than maybe we might have been able to tolerate in the past. Our eyes.
I think I was going to ask you one message, and I think you've summed it up at the end there. Yeah, I think people do just I think we just need to be aware, and it's men as well as women,
It is.
of I was saying on a previous webinar, I'm very good at washing my eye, keep cleansing my eyes with a foamer every morning, and clean it, wash my face every morning. I don't know if it's probably a bloke thing that I'm not very good at doing it in the evening. And if there's one thing that message that's come across from all the webinars we've done is I really need to repeat the process twice a day, or once more a day to do it twice a day in the evenings as well. Um, so yeah, better hygiene around the eyelids is ultimately what's going to help us improve our situation. Thank
Yeah.
you, Nicola. We haven't got any questions tonight. Oh, yes, we have one that's just popped in, and maybe it will. Um, oh, this is a good question, actually. Thank you. It's anonymous, but is blepharitis a catch-all term from dry eye or specific example? Which is a great question.
It's a really good question. So blepharitis is inflammation of the lid margin, and it can dry eyes is the catch-all term. Dry eyes is a catch-all term for the ocular surface being vulnerable and being like not optimal. But blepharitis specifically tends to be related to meibomian gland dysfunction because that is what keeps our eyelid at its healthiest, to your point, Nick, microbiome. And without that, then the lid margin starts to get inflamed, and you can have anterior blepharitis, posterior blepharitis, but the catch-all is really dry eyes for the symptoms, and blepharitis is itself a diagnosis of that, maybe the cause of the dry eyes coming from the lids. Is that fair? Versus, for example, your lacrimal gland or another part where the source could come from somewhere else in the eye. Is that, Nick? What would you say?
Yeah, I agree. I guess the other thing, I guess, with blepharitis is, it can have a different cause from it can cause dry eye symptoms, but it can have a different cause from dry eye. And of course, we're aware of Demodex related blepharitis, which we know increases with age. The older we get, the more likely we are to have Demodex. Well, we all have Demodex to a certain level. It's when it overgrows and starts to become a problem. So, and actually, the Demodex mites will cause a lot of discomfort and irritation on the eyelids, and of course the collarettes around the eyelids that create that sort of blepharitis appearance. And we'll need a separate treatment from just heat and massage. You do need to tackle the root cause of the problem, and there are new medications for that, of course. But actually, things like tea tree oil, well, not tea tree oil per se, the active ingredients. One of the things actually that is probably worth saying, and I'm sure you will agree, Nicola, is that tea tree oil products we have to be very careful with,
Yeah.
because there's a lot of nasty stuff in tea tree oils from an ocular perspective, isn't there?
Yeah, we don't formulate with tea tree oil at all anymore. But like you said, that's just a decision we've made. There are good types of tea tree oil. It's just that it's very hard for a consumer to tell the difference.
Exactly. The key thing is there's an active ingredient in tea tree oil called terpenem 4-ol, or we um, abbreviate it to T4O, And that's actually what you need, particularly for Demodex. Regular treatment with terpenoid will reduce Demodex mites down and improve blepharitis, and thus reduce symptoms and generally improve people's dry eye symptoms. Um, Angela asks if she has a multifocal implants, does that cause dry eyes? I can answer that. You can answer it. Per se, no. Um, However,
I shouldn't.
we do know surgical procedures can, any kind of surgical ocular surface procedure, whether it's refractive surgery or cataract surgery, which would include multifocal implants, will potentially cause dry eye symptoms. And it's very important if you're going for that surgery to talk to your specialist about your ocular surface health, because if you haven't got good ocular surface health, you're going to have more problems, aren't you?
Yeah, and on the flip side of that too, if you have ocular surface problems, they might not do the surgery, or you might end up being like putting a complex surgical pathway versus a simple surgical pathway for something like a multifocal lens, because of how important your ocular surface is to them doing a successful surgery too. So a lot of times people have been told they need to get a handle on their dry eye symptoms before they can have, whether it's LASIK or cataract surgery, they need to kind of get that under control before having the surgery too.
Yeah, absolutely. To follow on, Angela says she has rheumatoid arthritis, and
Oh, yes. That's a big um yeah, risk factor for dry eyes because of the inflammation. It's the same. So any systemic inflammatory condition will likely manifest in the eyes as well as inflammation, which we know is like linked to dry eyes. It's also true of like rosacea. Um, yeah, that can absolutely. And it does tend to improve if you're on with the medication that you might be taking to manage your dry eyes. Sorry, your rheumatoid arthritis. It can also help if it's bringing the inflammation down generally. But yeah, it is those yeah, inflammatory conditions, they do manifest in our eyes too.
okay, that's all our questions, Nicola. Thank you very much for your time today, taking out time in your busy schedule. For anyone who has wants more information on dry eye, the Dry Eye Zone has a plethora of blogs around loads of different subjects and angles looking at dry eye that are totally generic to designed to educate patients. So feel free to take a look at those. Um, and yeah, thank you for participating in the last webinar of Dry Eye January.
Oh,
And I
thank
look forward to us repeating the exercise last year, hopefully on the back of all these four webinars. The people that have attended and the people that watch the recording subsequently will have a much greater insight and a much higher awareness of this potentially debilitating condition. And the more we can do to raise awareness and educate people as to things they can do about it, the better it's got to be. So thank you for playing your part in that, Nicola.
Thanks, Nick. Always a pleasure. Thanks everyone for attending. Appreciate it. If you need
Thanks.
anything, just or you can always email me, nicola@peepclub.com.
Okay. Well, that's very good of you. Thanks, everybody. Bye now.
Bye.